Goltz syndrome and Goltz Gorlin syndrome. So this video will see the two differences between these two confusing syndromes. So before we get into know about the syndrome, you should know who these two persons are. So Robert Garland and Robert Goltz, they both were colleagues working in University of Columbia, and they both were mainly involved in all the oral presentations of different syndromes. So, whenever any new syndromes or new findings were there, they comprised all the findings and presented a case report. And whoever's name was the first author, eventually that syndrome got that person's first name. So, that's how we got two different types of confusing syndromes. So, first one is Gorlin Goltz syndrome. The other names for Gollin Goltz syndrome includes nevoid basal cell carcinoma syndrome, basal cell nevus syndrome, multiple basal cell carcinoma syndrome, Garland syndrome, or Gollin Goltz syndrome. So the signs and symptoms of Gollin Goltz syndrome includes multiple basal cell carcinoma of the skin, OKC, rib and vertebral abnormalities, intracranial calcification, skeletal abnormalities which includes the bifid rims, kyphoscoliosis, early calcification of falx cerebri. Then there is distinct facial appearances which includes frontal and temporoparietal bossing, hypertelorism and mandibular prognathism. There is bilateral ovarian fibromas and 10% even include they develop cardiac fibromas. So these are the different presentations of the Goltz-Gorlin syndrome. The reason could be because of mutations in the PTCH gene, which is a tumor suppressor gene on chromosome 9. The diagnosis of this Gorlin Goltz syndrome is based on the major criteria and minor criteria. So the diagnosis is given by two major criteria or one major and two minor criteria. So the major criteria includes more than two basal cell carcinoma or one basal cell carcinoma in a person younger than 20 years, OKCs of the jaw, usually they present with multiple OKCs, three or more palmar or plantar pits, ectopic calcifications or early calcification of the falx cerebri, bifid rib, first degree relatives also present with the similar features. These are the major criteria. Then you have minor criteria which includes macrocephaly, congenital malformation which includes cleft lip palate, frontal bossing, eye anomaly like cataract, collarbone of the eyelids, microphthalmia and nystagmus. Other skeletal abnormalities include springdale deformity, pectus deformity, polydactyly, syndactyly or hypertelorism. Radiological abnormalities present as bridging of the celatosica, vertebral anomalies, modeling defects or flame-shaped leucines of hands and feet. Then you have ovarian and cardiac fibroma or medulloblastoma. The next one is Goltz Gorlin syndrome. So the Goltz Gorlin syndrome, other name for that includes Jessner-Cole syndrome, focal dermal hypoplasia or Goltz syndrome. So this focal dermal hypoplasia is quite a rare syndrome compared to the Gorlin Goltz one. It is a form of ectodermal dysplasia. It is a multisystem disorder characterized primarily by skin manifestations to the atrophic and hypoplastic areas of the skin which are present at birth, and they manifest as yellow pink bumps on the skin and pigmentational changes. The disorder is associated with shortness of stature and some evidence suggests that it can also cause epileptic attacks. Apart from that, the other things which include the name Gorlin includes Gorlin cyst and Gorlin sign. So Gorlin cyst. The other names for Gorlin cyst includes calcifying odontogenic cyst, calcifying cystic odontogenic tumor, dentogenic ghost cell tumor, calcifying ghost cell odontogenic cyst. So calcifying odontogenic cyst is a rare developmental lesion that comes from odontogenic epithelium. It is also known as calcifying cystic odontogenic tumor. Do not confuse this with the Pinbock tumor. That is different and this is different. So this calcifying cystic odontogenic tumor is a proliferation of odontogenic epithelium and scatteredness of ghost cell and calcifications that may form the lining of the cyst or present as a solid mass. It appears in any location of the oral cavity but mostly affects the anterior mandible and maxilla. Dental radiographs it presents as unilocular radiolucency And one third of the cases, they also have impacted tooth associated with it. Histologically, they present ghost cell with enlarged eosinophilic epithelial cells without nuclei and are present within the epithelial lining and may undergo calcification. The last one is Garland sign. Garland sign is the ability to touch the tip of the nose with the tongue. So, approximately 10% of the general population can perform, but whereas 50% or more than 50% of the people with a connective tissue disorder known as Ehlers-Danlos syndrome, they can easily do this act. And this was named after the same person whose name had the same syndrome like Gorlin Goltz syndrome. So, this was named after Robert J. Garland. And the sign is the ability to touch the tip of the nose with the tongue. This is a medical sign.